Hi, my name is Zibner. Welcome to my journey to become a clinical oncology pharmacist. This is my story. I was born in Orlando, Florida as a 2-month early emergency C-section preemie baby to my mom who immigrated here from Guyana and to my dad whose family came to Ellis Island to survive the tragedies of World War II. My parents worked extremely hard to make sure I would have a better life than they had. My mother, coming to the US with hope in her heart, chasing the American dream, working 3 jobs at a time. During my birth, the placenta ruptured, causing a medical emergency. The dedication of the nurses, doctors, and weeks of incubation at Arnold Palmer is what saved me and my mom's life. Although I grew up as an only child, I enjoyed any time I got to spend with my dozens of cousins or 11 aunts and uncles, most of whom live back in Guyana or in Toronto. Whenever we get the chance, my parents and I love to take road trips or travel, enjoying the sights and sounds of the world. I was lucky to visit Europe with my senior class a few years ago, where we were able to appreciate their different cultures. Of course, here at home, I love cheering on Orlando's hometown team, here at UCF with all of my friends. Throughout high school, I've always strived to make my parents proud by excelling in academics and serving my community. Becoming a first-generation college student was my pathway to support the family that has given me so much. I continued to make the honor roll throughout high school and got involved with student government, even graduating as the National Honor Society president. When it seemed like everything was going well, disaster struck, as we learned that my grandfather was diagnosed with aggressive non-Hodgkin's lymphoma, and soon after, my aunt with chronic myelogenous leukemia. It seemed as though when it rained, it poured. I stayed close with my grandfather as he underwent harsh treatment, and it surprised me how much drug therapy could completely change you. Becoming very weak, he sadly passed away. Little guidance was given to him, and I couldn't help but think of all the other patients who were lacking counseling when facing a tremendous illness. This experience changed me, and this is when I decided that I wanted to be a professional who could comfort and inform patients about their treatment every step of the way. As a clinical oncology pharmacist, I know I can do that. The field of pharmacy allows me to implement a tailored approach to treatment by contributing to patient-centered therapy, taking into account their unique situations. As a liaison for the community, I can optimize treatments that conform to their specific needs. In college, my childhood friend and I became roommates, and we planned out our entire curriculum, working extremely hard to complete our degree in 3 years instead of 4. I soon became advertising director and then vice president of the Pre-Pharmacy Society, where I was able to converse with pharmacists from various specialties and learn about the many responsibilities they hold. I also joined the UF Pharmacy Mentorship Program, where I developed invaluable relationships with UF Pharmacy students and was grateful to receive irreplaceable advice. To gain hands-on experience, I decided to complete training to become a registered pharmacy technician and got a job at Publix where I shadow a retail pharmacist. I have learned so much about medications and strategies for treatment. I've been able to see how the pharmacist acts as a true liaison between the community and the healthcare industry, and it has inspired me to provide patients with unparalleled care. Occasionally, the pharmacist informs patients to their surprise that their prescription would have adverse effects. Lack of communication between providers is what I believe is the underlying cause of frustration for patients. As a student and future pharmacist, I hope to pursue my goal of providing patient-centered care by collaborating on an improved system, ensuring that every healthcare professional catering to a patient is well informed. To enhance the outcome of a patient, we must work as a team instead of separate entities. Modernizing the healthcare field starts with professionals like pharmacists. My experiences with family hardships, challenges of balancing rigorous coursework with roles of service, and my time as a pharmacy technician have motivated me to use everything I will learn and apply it in the field of pharmacy. So that's me and my pre-pharmacy journey. Thanks for listening.